Taking TB medicines is a daunting task as these medicines are very bitter, and only then can they kill this stubborn bacterium. If you ever feel jaundice, blurred vision, spots on the skin, dark-colored urine, fever, body or joint pain, loss of appetite or nausea or earaches while eating them, be sure to contact your doctor or a DOTS center if you experience nausea or abdominal pain. Sputum/sputum tests are done at regular intervals during treatment to help monitor the effectiveness of the treatment. However, at home, dispose of used tissues or cloths containing sputum or mucus in a tightly closed container. Eat a good, balanced diet in which fat is minimal. It is not necessary to eat meat to get protein, but the whites of local eggs, pulses, and porridge, black and white chickpeas, and peanuts are also useful, and they can be used to take TB drugs. During the patient should do. Also, all seasonal fresh fruits, vegetables, and adequate amount of water play a special role in keeping the patient well and avoiding the side effects of medicines. One precaution is equally important for everyone. Even if the house is small, the ventilation should be arranged well. Whether it is winter or summer, open the windows and doors to allow air and light to enter the house, and get rid of unnecessary things quickly. Elimination of dampness and mildew, etc. Increased poverty, cramped housing, and malnutrition lead to the growth and spread of TB. Drug addicts are also prone to it.